Maternal, Adolescent and Reproductive Child Health Care March Initiative, an NGO, has urged government to implement policies that support health and nutritional needs of children with anomalies in the country. Mrs. Olubumi Ayedin, founder March Initiative, made the call in Abuja during the final validation symposium training manual on orofacial cleft community care and support in commemoration of the 2023 World Defect Day.
One of the things the government should do, the government own the people. So they have primary responsibility. Which one? Policy. Because when we have policy that recognize children with bad defects, there can be interventions. We can have budgets. We have behavioral change around children with abnormalities. When the government puts it in the policy, that the policy of this nation says protect, promote and support every newborn, every Nigerian child with bad defect. Where we can say as training institution like university need to integrate part of the curriculum that speak to children with birth defects. So policy is very important.
Dr. Lillian Ekwem, Chief Pediatrician, Wuse District Hospital, said the purpose of the workshop was to get people from different health professional backgrounds to look at challenges associated with children born with defects.
That's why we are organizing these workshops. One of the objectives is to be able to highlight these complications of this condition and teach, health workers how to approach, taking care of such a baby up to the grassroots level. So some of the problems that we've observed is that babies who are born with birth defects tend to suffer a lot of stigmatization, discrimination, neglect, abuse, and in this instance we are zeroing in on babies who have what we call orofacial cleft.
Assistant Chief Scientific Officer NPHCDA said the day was a unique day set aside to celebrate a special group of children who are often neglected in the society.
My message for today is that we need to recognize people born with birth defects, people born with cleft palates. There's a lot of awareness that needs to be done, especially for children who are born with such conditions and are not. The conditions are not known. It can lead to issues of malnutrition, especially with newborns. So it's very, very important for even the health workers to be sensitized.
Our project, USAID Advancing Nutrition project, is generally has the mandate to improve the status of nutrition in children in Nigeria. And we are actually happy to be included in the sponsoring of this activity and marking today through the initiative of March initiative. And I think for us, what we have participated to do for children with special circumstances like this is to ensure and support the Federal Ministry of Health in its review of the MySIN strategy, policy, and the training manuals.
The workshop was, however, organized by March Initiative in collaboration with the National Primary Healthcare Agency, USAID Advancing Nutrition, among other partners.